muscular pump. And we want to make sure that heart efficiency stays high. We want to make sure the heart is working well and effectively. So we might ask, what are some things we can do to help improve our heart health, and what might be some indicators of our heart health? So what might influence some of those things? So let's look at heart rate. These are just typical kind of broad numbers for heart rates. For an infant, their heart rate is about 120 beats per minute. So we might be kind of shocked by that, right? Wow, it's really fast. But for an infant, that's okay. For a teenager, the heart rate might be closer to 80, 95 beats per minute. For an adult, it's closer to 70 to 80 beats per minute. That's a fairly normal range. Extreme athletes might be a little bit lower than that, but those are typical heart rate ranges. So long as they're within those or close to those numbers, that's evidence that their heart is working normally. Normal blood pressure, we have to measure two different numbers. The top number, we call that the systolic number. That's when the ventricles are contracting and there's a lot of blood going into the aorta. When that happens, it creates a lot of pressure. We can measure that pressure. We call that the systolic pressure, close to 120 millimeters of mercury. The lowest number is after the ventricles have contracted. Now they're relaxing diastole. So this is the diastolic pressure. That number is typically around 80. So there's always going to be some pressure in the blood vessels. The highest pressure should be close to 120. The lower pressure should be close to 80. But let's find your resting heart rate. So all you have to do is time yourself for a minute, find your pulse. So you can find it on your wrist. Just put your fingers really lightly on your wrist. You don't have to press down very hard, but you'll feel your pulse there. Or on your neck, you can feel your pulse here. Just count how many times it beats as we count down 1 minute. So hopefully you found a heart rate within your normal range. How do we measure blood pressure then? To measure blood pressure, we use this special tool. Sphygmomanometer. A sphygmomanometer is a combination of a blood pressure cuff with a stethoscope. So we use this to measure our blood pressure. And if it comes out higher than that typical 120 over 80, if the pressure is higher than that, we call that hypertension. Hypertension is just a scientific word. Hyper means above. In this case, high blood pressure. The blood pressure is higher than normal. And it's called a silent killer because it's very devastating. High blood pressure can be very devastating on the body, but it's hard to detect. So that's why your doctor constantly checks your blood pressure, or you could go to a grocery store sometimes and have your blood pressure checked by the pharmacy there. Because it's sometimes a very devastating thing to the body. Imagine a high-pressure hose pounding on your wall. So if you were or your deck, let's say you were trying to clean your deck, if you rented a pressure washer or power washer, you get that high-pressure water spraying on that wood, yeah, it'll take the paint off. Sometimes it'll start cutting into the wood. Same thing with your blood. As it's pounding against those weaker, thinner tissues, the tender or small capillaries, some of those tissues can't take that continued beating from that high pressure. It can cause a lot of damage, especially in some parts of your body. So we sometimes call it the silent killer because of the damage that high blood pressure can cause if it's over 120 over 80. And we'll see what might cause some of those numbers to go up. So when you're checking blood pressure, when someone's measuring blood pressure, exactly what are they doing? All right, so here's your blood flowing through your arteries. All right, there it is, flowing through your arteries. What they do is they inflate the blood pressure cuff. When they inflate the blood pressure cuff, it's going to create enough pressure to squeeze that artery closed. All right, then they release the bulb, and when they release the bulb, the blood will start to flow again. Now listen to those sounds. All right, because this is what they're listening for. When they put the stethoscope on there, they're listening to hear when the pressure stops and when it starts again. All right, so you're listening to hear those blood sounds. Like, at what pressure do you stop hearing the flowing of the blood, and at what pressure do you start hearing the again? So that's what they're listening for. So what they do is they inflate the cuff on your arm, totally block off all the blood. The needle's up high. Then they slowly let off the pressure, and as they let off the pressure, they're listening. When do they first start hearing the sounds of the blood flowing through your artery? And then when does it level off again? So they stop hearing the and start hearing the All right, that first time they hear the sound, that's the systolic pressure, because that's the pressure of the blood against the cuff. Now it's finally had enough pressure to push through. They hear the sound. When the blood first pushes through, that's the top number, the systolic pressure. And then they hear until finally they don't hear the sounds anymore. That's the diastolic pressure. So listen to that one more time. Inflate the cuff. We no longer hear it. That's the systolic. First time we hear it, that's the systolic pressure. And now it's the diastolic pressure, just like that. So here's what they're doing. She puts a stethoscope on the arm, inflates the cuff so that it squeezes the blood flow shut. Then she slowly releases the pressure. As she does, the needle starts to go down. As the needle starts to go down, she's listening for the first time she hears sounds. The first time she hears sounds, that's going to be the upper number, the high number, the systolic pressure. She's going to continue to hear sounds until the pressure from the cuff is too low and the blood is flowing normally. And that will be the diastolic pressure, the low number. So that's what she's listening for on the brachial artery. So this is kind of what it looks like graphically. Like, here's your heart beating. Ventricles contract, ventricles relax. Ventricles contract, ventricles relax. So they inflate the cuff so the cuff pressure goes above what the ventricles can produce, the pressure the ventricles can produce. So you don't hear anything. It's completely compressed. There's no sounds. Now we slowly let that pressure off. Slowly let the cuff pressure off. Slowly let it off until we start to hear it here. We hear that blood moving through that artery until we get to here where the pressure is too low. And we measure those two numbers. So in this case, what's this person's blood pressure? Here and here. So we scoot on over to here. It's around 78. Up here, it looks like it's around 118. So maybe 118 over 78, we would say. Something along those lines. Take a look at this little chart. Try to decide who has the best blood pressure. Well, you might say Sally's way out, because look at this. Her blood pressure is way out here. 135 over 100, way too high. She has some hypertension, maybe even beyond that. Here we have like Jimmy. His is still a little bit high, maybe 123 or 4 over 75. It's still too high. Here we have Roger. He's right about 115 over 80. So he's not in bad shape. Jenny down here, she has 70, maybe 100 over 70. So hers is a little bit low to normal. She might be in the best shape. Roger's in really good shape. Jimmy, he's a little bit too high. Sally, she's way out of the ballpark. She's in big trouble. Big trouble. So what are some major things that could affect blood pressure? Here's 4 major things that could affect blood pressure. One of them is cardiac output and heart rate. That is how fast your heart beats and how much blood you're putting out with each beat. That has a major impact on your blood pressure. If your heart rate stays low, that can help. If your cardiac output stays high so that you only have a few beats per minute, 60, 70 beats per minute, you're putting out good cardiac output, you're going to have good blood pressure. Other factors, though, is what we'll focus more on in this lesson. Peripheral resistance is a major factor, your blood volume is a major factor, and your blood viscosity is a major factor. So peripheral resistance, blood volume, blood viscosity, all major factors. Peripheral resistance is influenced by two things, vessel length and vessel diameter. Let's take a look at how. Here's how vessel diameter can affect peripheral resistance. The resistance of the blood vessels on the flow of blood. Think of it kind of like a hose. If I have this nice, thick hose, and I have this smaller diameter hose, how will they compare when the water comes out? The same volume of water, just a larger vessel compared to a smaller one. And you know this because you've done this already. You take the hose, you put your thumb over the top to spray the water, increasing the pressure by decreasing the diameter. Same amount of volume. All you're doing is changing the diameter. So large blood vessels with the same amount of volume, low pressure. Smaller blood vessels, same volume though, much higher pressure. Now what could make that vessel diameter smaller? Well, there's lots of things. One thing though could be you get, your arteries start to get lined with plaque and cholesterol starts to build up, and it decreases that diameter, that vessel diameter, which is going to increase the resistance, which will increase the pressure. Here's another example, and that is blood volume. Right, so blood volume can also have a big impact on it. So as your blood volume goes up, your blood pressure goes up. As your blood volume goes down, your blood pressure goes down. So take a look at our guy here in the summertime. He's sweating. Because he's sweating, he's losing a lot of water. The blood volume goes down because the water content's going down. So because the blood volume goes down, notice here the pressure starts to drop. Over here we have a person that's eating lots of salty chips. That salt causes water retention. So instead of losing water like this guy, this person is retaining water. By retaining water, the blood volume goes up and the blood pressure goes up. So pressure and volume definitely related. Let's take a look at blood viscosity, the thickness of the blood. The thicker the blood, the higher the pressure. So take a look at our pressure, 120. We increase the viscosity, we make the blood thicker, like ketchup sort of, thicker. The blood pressure goes way up. It's much harder to deal with. If we decrease the viscosity, we make the blood thinner, the blood pressure goes way down, which is why sometimes people with high blood pressure might take blood thinners like aspirin to try to thin the blood a little bit, lower the blood pressure some. So the heart doesn't have to work as hard to circulate that blood. Pressure goes down. Atherosclerosis is just the narrowing of the arteries by these fatty deposits. So you eat a lot of cholesterol, fatty foods, it starts to accumulate on the walls of your blood vessels. That creates a lot of problems because it narrows the blood vessel, increasing the peripheral resistance, increasing the blood pressure. Your heart has to work harder. Your body tissues feel that pounding more. Bad things start to happen. It could eventually cause a heart attack or stroke if it completely gets blocked. It gets blocked enough where those tissues can't get the materials that they need from the blood. So if your heart doesn't get the oxygen it needs or materials it needs, those cells start to die. We call that a heart attack. Or if sometimes the clots or the pieces of the fatty deposits block the whole blood vessel, if it does that in the brain, so the section of the brain can't get blood, we call that a stroke. This problem of building up of fatty deposits is coronary artery disease. So as some people are more susceptible to this than others, as their heart blood vessels, the blood vessels that supply their heart, are being filled with fatty deposits. So here's a normal artery. The space inside is called the lumen. So here's our normal artery. The space inside is a cross-section called the lumen. But here you are eating lots of McDonald's. You're filling up with fat. So that artery starts to get blocked. Notice that the lumen narrows. Increase in peripheral resistance. Increase in blood pressure. Eventually can cause some problems as that artery is narrowing, so that so that it becomes completely blocked, and that can cause major problems. Heart attack if it's in the heart, stroke if it's in the brain, a lot of other problems in other places in your body. Completely procedure that sometimes medical places will use is called angiography. What they're going to try to do is see if your heart circulation system is being blocked, your coronary arteries are being blocked. So here are some of the options if they find that it is. One option is this, angioplasty. What they do here is they'll insert this tube, usually in through the leg. They'll go all the way up through your veins to get to your heart. They'll go through your coronary artery, and they'll insert this little tube where the blockage is, and then inflate the tube, which will help increase the vessel diameter, lowering the pressure, and hopefully pushing that plaque aside enough to allow blood flow to return to the heart normally. Another option is completely bypassing the blockage. If the blockage is really bad and they can't get a balloon in there to inflate it, what they might do is take a small vein from the leg and just bypass it entirely, like building a road around a city, a bypass. So now the blood will just circulate through that vein, that blood vessel, rather than the blocked one. And one interesting thing about your body is your body can build sometimes its own bypass around blocks with veins and arteries. Like your major veins and arteries are pretty much similar for most people, but then when you get to smaller venules and arterioles and those branching systems, there could be a lot of variety in what circulatory systems look like because of the things that individuals encounter and how your blood vessels adapt to it. So here's a heart showing some scar tissue. The question is, what might cause that scar tissue to form? So here again, these blood vessels are supplying the heart with oxygen, nutrients, but if those heart cells cannot get the oxygen and nutrients that they need, then they die. When they die, they just become scar tissue. So now that muscle, what used to be heart muscle, is now just scar tissue, is unable to perform the jobs of contraction, so the heart gets weaker and weaker. Eventually the heart might not work very well anymore. We call that heart failure. The condition in which the heart becomes just an inefficient pump, too much scar tissue. So what can we do to help? Well, not eat much cholesterol, keep our blood pressure low, those kind of things. So we don't have this inefficient pump where we have shortness of breath because we're not circulating oxygen and carbon dioxide around in our body very well. Fatigue because our tissues are not getting the sugars and the nutrients that the blood can supply like they should. Fluid accumulation because the vascular system is not able to drain fluids from places in our body. So what can we do? What are some things that we can do to help improve our heart? So here's 5 basic tips. Certainly limit your salt intake. Salt goes up, so does blood volume. Blood volume goes up, blood pressure goes up. So limit how much salt you eat. Definitely increase your consumption of fruits and vegetables. They help to clean out a lot of your system, keep those fat levels down. Definitely increase your intake of fruits and vegetables. Stop smoking. Nicotine and some of the chemicals inside cigarettes have a major impact on blood pressure. Vasoconstrictors. They'll make the blood vessels get smaller and narrower. That creates a lot of problems for your circulatory system. Exercise. Definitely get that heart rate up. Exercise. Try to get that heart rate stronger. And lose some weight. Because again, the longer the blood vessel, the higher the blood pressure. So if you add several pounds or several inches around your waist, you're going to have blood vessels that have to go that distance. That's going to make your heart work harder to get blood to all that space. You lose that weight, then your blood doesn't have to travel as far. Your heart doesn't have to work as hard. So that's one of the reasons why you want to lose some weight. Another reason might be, again, you accumulate lots of fat in your tissues. That fat might also start accumulating in your arteries, which can cause lots of problems. So stay healthy. Lower the heart, fruits and vegetables, stop smoking, get some exercise, and lose. So let's do some reviewing. Which of the following is an artery that takes oxygenated blood to the rest of the body? So it's leaving the heart, going to the rest of the body. That looks like the aorta. Which structures are present in the veins and prevent the backflow of blood? That sounds like this. Valves. Blood enters which chamber from the vena cava? So on the right side of the heart, the vena cava is going to lead to the right atrium. Which will not impact blood pressure? Well, we know that the diameter does because that's going to affect peripheral resistance. We know the viscosity of blood does. The thickness of blood makes a difference. We know that cardiac output makes a difference. So the number of white blood cells would not impact blood pressure. Which is a good blood pressure? So we're looking for something close to 120 over 80. So 160 over 80, the systolic, too high. 155, still too high. 100, a little too low. 115 over 78, that looks like a decent blood pressure.